Good morning. Welcome to the Pulse of Healthcare. This is Dr. John McCormick, and I'm here with Virginia, my head of claims department. And we're noticing a trend for some of these newer groups, and I know it's not a ultra new trend in the market, but it has seemed to be more and more emergent over the last probably 2 years, where we're starting to see age stratifications used when quoting these major medical plans from some of these legacy providers. And so, that's not one of our models. We don't use that, and there's some very particular reasons for that. But I'm going to kind of toss this over to Virginia to talk about it a little bit from a claims health perspective. Why, to me, this age stratification to think if you're younger or if you're in this age bracket, for some reason your cost could be, the quoted cost might be a third of somebody that's in their 50s, and how, in our experience, that just doesn't align. So, Virginia, what are you seeing when it comes down to that?
It's blowing my mind, the increase of it, and like you said, based on the age, the varying prices the older the member gets, and with the way the healthcare claims have been coming in the past couple of years, that doesn't sit right, because if you're giving a quote and you're using the age stratification, which would tell you, okay, because this is an older person, therefore they may have a higher chance of increased claims, we need to increase their premiums. Yet the trending in claims coming in physically to review, it's not that, it's across the board. You've got young ones, you've got kids, you've got relatively what you would mostly consider young, healthy adults. Their claims have increased, and it's the older ones that may not have as many claims as what this age stratification is implying they might have.
So, what kind of claims are we seeing? So, age stratification has been used for a long time for different things. And the traditional wisdom is, of course, young people don't get sick, go to the hospital. Most of them don't even have insurance, or on their parents' policy or something like that. That's why they extended under the Affordable Care Act, extended where you could stay on your parents' policy until you were 26 and go into college and those kinds of things. But from my experience as an educator and in the military, the young folks that came in, barring injury, were generally pretty healthy. Right? And we saw because of the fitness level of the members in the service, everybody was generally healthy, generally all the time. I mean, it's not like we didn't get the flu and, some colds and things like that. But there wasn't this, overwhelming need for people to go to the hospital, go get surgery, be out for a protracted period of time. So, I served in units with 1,500 to 2,000 men and women. And really the only people that we had out for any protracted period of time were people that were injured, obviously, in war, or some of our female troops that were pregnant. So you'd almost think, if you were going to bracket people by age, right, that women would also have a higher expense than men if they were in those childbearing years. But we're not seeing that trend either.
No.
So what are we seeing in claims wise that kind of, I guess refutes that, what we would think, oh well, yeah, you're older, you're sicker, you're going to cost more mentality, that's just not showing up actually in the utilization.
To me, this is a result of, in some form or fashion, one of several varying ways, but this is a result of the COVID pandemic. The increase in, you've got to go to the doctor, whatever reason, excuse, whatever reason, right? As well as the after effects, because people prior to COVID weren't as health driven as they are now. So now you can go in because you sprained your pinky finger and everyone's going to panic. You're going to panic. You know, go to the emergency room because it hurts, there's a cut, there's whatever, it's a sprain. What we're seeing an increase of is these side issues from the result of being sick and the immune system not being as strong as it once was, because we're seeing a lot of infections. We're seeing a lot of high infections. We're seeing increase in specialists because of the varying infections that these members are getting.
Probably more across what we call pulmonary and cardiology, right? So,
yes.
So,
but even some of the other organs.
So if I was going to repackage what you just said, what I would say is claims now, where traditionally you might have thought an older person is going to cost more. Mm-hmm. What we're seeing now is that's not necessarily the case, because post-pandemic here, what we're seeing is almost an, I hate to say an increased paranoia that people are seeking care for things that they might not have sought care for before, or at least seeking a test. I've got this or that. I better go get tested. And so that's driving up cost across all age brackets. Right. And then what we're also seeing is some really kind of an emergence of, pulmonary cardiology events and things like that in a much younger population that they generally manifested than they generally manifested before.
Correct. As well as the infections, we'll say, because it can be anything, or not, where they were not as common, now they are common. So, for example, sepsis. Sepsis is an infection, it's a bad infection. But the increase in the amount of sepsis cases because someone didn't pay attention to their body, we'll say it that way, didn't pay attention to their body, let something go on too long, or didn't realize how bad, quotation marks there, this was, and when they finally went in to go seek the testing, it's real bad, so now they've got to go here, there, and everywhere, or do the at-home IV antibiotic therapy for an extended period of time to try and get rid of it.
So, kind of circling back to the theme on this, and this is, obviously this is our anecdotal evidence. We're not doing a big research study on this and spending thousands of dollars. We're just telling you what we know from our population, from what we're seeing. All right? Everybody's experience might be a little bit different, but what we think is a couple of things. First of all, where age stratification obviously has a place when you're producing a quote from a historical standpoint, what we're seeing in these quotes is a really wide gap, which I think is unfairly burdensome to the older, potentially healthier population. So, our average age within our groups is about 40 to 45. And believe it or not, we're seeing more sickness in that below 45 group than we are in the above 45 group. Now, granted, when you get into 65 and older, that's when you're getting into your Medicare population or your Medicare Advantage population. And anybody that's done any studies on that will tell you most of the medical costs actually occur within the last year of life. Mm-hmm. So even in that population, 60 to 85 particularly, you don't really see a huge spike in medical care until you get into that last 12 to 18 months of somebody's life, generally because they're having some catastrophic events that are leading to the end-of-life event.
Correct.
All right? So we don't think it's fair. That's what we're saying. We don't think it's fair, and I think when we're looking at, small and medium employers that have a range of employees from young to old. There ought to be some kind of equity of pricing across employee or employee spouse, child, with children and family. So everybody has the opportunity to be able to purchase affordable health care and not get taken out of the game just because, well, guess what? This year I turned 48 and instead of my health care costs being $550 or $600, now the insurance company says I've got to pay $900 for the same care I got last year, and I'm completely healthy.
Mm-hmm. One that I saw yesterday, it was for 64 plus, almost $2,000 a month.
That's just incredible. That's just incredible. So and I think in that same group, if you were in the lower age bracket in the 20s or something like that, it was like $400.
Yes.
So
yes.
$400 if you're in your 20s in childbearing age, which can be extremely expensive, and up almost $2,000 when you're in your upper 50s or 60s. That's just,
it's insane.
Yeah, and of course people are going, well, the older people are the ones that are higher up in the organization. That's not necessarily true. I mean, a lot of people have multiple careers. I'm one of those. Served in the military, was a school teacher. Now I'm doing this, and a lot of times, people kind of restart, or this is their second job, and they're getting insurance, and just because they're older doesn't mean they're in a supervisory role, making a lot of money.
Exactly.
They could be making the same as the 18 to 25-year-old.
Exactly. Or training them how to properly do what needs to be done.
Absolutely. Absolutely.
So.
Wow. So it's just something we want to throw out there. We like to have podcasts about things that are on our mind. This is on our mind. I don't know that we have any way to actually change or look at that trend, but it's certainly worth getting out there in the collective conscious of employers to be thinking, if you're one of these employers that are getting quoted on this wide range of plans, remember a couple things. First, it's an actuarial drill, not a health drill, right? All they're doing is just changing where they're putting the dollars, but they're not lowering the amount of dollars they're actually collecting.
Correct.
All right? It's really just shifting the ball around, so ultimately these major medical plans are still making all the profits.
Correct.
All right? So by shifting the numbers around, it becomes more of a marketing scheme than a healthcare scheme, in my opinion.
I agree. But still, overall, I would, if it was me having a quote like that, I'd be questioning the daylights out of the person that's providing me the quote and the legacy company issuing it. Because I just, in my mindset, knowing what we do here, how much we take care of our members and our groups, I cannot see doing anything like that as being even remotely close to fair or reasonable.
Yeah, I can absolutely see risk rating a group based on the overall health of the group. Absolutely see that. But risk rating a group by individual based on their age without regard to their physical condition, I cannot see that at all. I just don't think that's a fair measurement.
Not at all.
All right. Well, thanks for joining us for the Pulse of Healthcare for this episode. We'll be back in a couple of weeks for the next one. Thank you, Virginia.
You're welcome.